Again, and I'm going to present a rare fetal echo case which has multiple findings, and that's how you would be able to dissect and see a step-by-step approach to a patient with a congenital heart disease on a fetal echo. Sequential segmental approach would be the best, and in this the very first thing what we see is the abdominal situs, and we say that there was a right atrial isomerism, and there was a common AV valve, and there was a right ventricle which had a double inlet, so it was double inlet right ventricle. Then there was a transposition of the aorta was arising from the right ventricle. There was a pulmonary atresia, and pulmonary arteries were arising from the descending aorta called MAPCA, and there was a TAPVC, total anomalous pulmonary venous drainage, which was opening directly into the right atrium, called intracardiac type. So let us go step by step from each finding. Yes, it's a good idea to subscribe. The moment I'm going to post a new video, you would be notified, and I think you won't miss it once you see the notification. So let's start with the abdominal view. And in the abdominal view, a cross section, what you see, this is the stomach, and this is the aorta, and this is SVC, that's the spine. So now you notice the spine, the stomach, this is actually the right side, where we based on the orientation of the fetus, and both aorta and IVC are actually on the left side. Stomach is on the right, aorta and SVC, IVC are on the left side. Both IVC and aorta being juxtaposed indicate a right atrial isomerism. And here you see a 4-chamber view on a 2D and a color Doppler. You notice, right, let's start from here. Apex is kind of formed by the right ventricle. This is a coarsely trabeculated ventricle with a moderator band, testifying that this is the right ventricle. Then coming to the left, there is a left ventricle which is smooth walled. It is hypoplastic. Now notice here there is a common AV valve, and there is an inlet VSD, there is a primum ASD. So this is a common AV valve or common AV canal defect. Common AV valve is opening directly into the right ventricle, and it is not opening into the left ventricle. Notice here the inflow from the left atrium and the right atrium coming into the right ventricle, and only through a small VSD the flow is going into the left ventricle. So this means that the right ventricle is double inlet. Left and right atria are both opening into the single ventricle, which is the right side, right morphology, and the AV valve is a common AV valve. Please notice something coming from here into the right atrium. I would show you subsequently. This is an inflow sign from a total anomalous pulmonary venous drainage. Watch this video till end, because I am going to show you each and every case separately. Now another thing what you should notice here is that now this is inflow, and the right and left inflows are going into the single ventricle. Not only that, there is a mitral and tricuspid regurgitation, or a right and left AV valve regurgitation, because this is a common AV valve. Now 4-chamber view, looking at a little closer angle, and this is the lateral view. This is the best view to see the appendages. So you see both the appendages are circular broad, which indicates that both are right atrial appendage morphology. This confirms our diagnosis of right atrial isomerism. Remember, looking at the atrial appendages, making a diagnosis of isomerism is not easy. The sensitivity is not good. You can't see the atria very clearly, appendages very clearly in most of the cases. But where you see, you can make a diagnosis. Now let's come to the next step of the diagnosis, that is total anomalous pulmonary venous drainage. Now look at this left panel. You see this is a left pulmonary vein. This is the left lower pulmonary vein, left upper pulmonary vein. Left lower comes with an angle from the border. It actually circles the left heart border. The left upper pulmonary vein and left lower pulmonary vein join together here, and they do not enter into the left atrium. They pass across the left atrium and forming what we call as a twig sign on this side, and you see the distance between the aorta and left atrial wall is increased. All are markers of the TAPVC, total anomalous pulmonary venous drainage. Now you see the next video. I showed you left lower and left upper pulmonary veins forming a common vein and coming here, common left vein, and then this is the right upper pulmonary vein, right lower pulmonary vein. Both are opening into this posterior chamber, which is finally opening into the right atrium. So this is a total anomalous pulmonary venous drainage from left and the right side, opening into a common chamber, and it opens into the posterior wall of the right atrium. Thus, it is an intracardiac type of a TAPVC. The next kind of intracardiac TAPVC is when the pulmonary veins open into the coronary sinus. Again, reminding you a basic sign. There is the aorta and left atrial appendage. They are distantly placed, and to make an assessment, if you can place another aorta between aorta and LA, so that means this aorta distance is increased. You see this twig sign behind the left atrium, signs or a mark for total anomalous pulmonary venous drainage. Now, you going a segmental approach, you go to the right ventricle and you see the aorta arising from the right ventricle. Okay, so that means aorta is transposed to the right ventricle. What about the pulmonary artery? We don't see pulmonary artery because this is just single vessel coming out of the right ventricle, which was in fact double inlet right ventricle. So this aorta is arching towards the neck vessels. These are the neck vessels you see, and this is a aorta, and you don't see any sign of pulmonary artery. What should we do next? If you don't see a pulmonary artery arising from the right ventricle, and how sure can we be whether the pulmonary artery which you see a small is arising from right ventricle is looking at the pulmonary valve. In case you have a pulmonary valve, that means it's coming from the right ventricle. You don't see pulmonary artery, so what do? The next step is look for the pulmonary artery which is arising from the aorta, ascending aorta, either from the posterior aspect or from the lateral aspect. In case you see pulmonary artery or its branching arising from the aorta, this becomes a common arterial trunk, in the past called truncus arteriosus. Now the next step is the pulmonary artery arising from the isthmus, where you normally find a ductus arteriosus. Then it is the pulmonary artery arising from ductus arteriosus, which is filling retrogradely. In fact, this is the commonest form of pulmonary atresia, where you see the pulmonary artery retrogradely filling from the ductus supplying the left and right pulmonary arteries. The third, which is the least common type, is that you don't see pulmonary artery arising from the ascending aorta, you don't see it is coming from the ductus arteriosus. Then you go back to the four chamber view and look at the descending aorta, which is lying behind the left atrium. I'm going to show you in my next video. So you go to the descending aorta at a four chamber view and try to look for the pulmonary artery, and this is the pulmonary arteries which are arising from the descending aorta, and many a times it's called MAPCA, main aortopulmonary collateral arteries. Now look at this. This is the descending aorta. For the landmark, this is the left atrium. This is the pulmonary vein which we saw, left pulmonary vein. This is the descending aorta, and you see the right pulmonary artery coming from the descending aorta at a four chamber view. And this is, incidentally, this is the right pulmonary vein which I showed you. Now this is the right pulmonary artery coming from the descending aorta. Then you see the left pulmonary artery coming from the descending aorta at the level of a four chamber view. So both right and left pulmonary arteries are directly arising from the descending aorta. So today I showed you a stepwise a case which had multiple findings, and the reason was a right isomerism which leads to a complex congenital malformations. There was a common AV valve. Then there was a double inlet right ventricle, left ventricle was hypoplastic. So this was a single ventricle of an RV morphology. Then there was an aorta which was coming out of the right ventricle. There was a pulmonary artery atresia. We did not see the pulmonary artery, but we saw the pulmonary arteries coming from the descending aorta as MAPCA. Then there was a total anomalous pulmonary venous drainage into the right atrium, which forms the type of intracardiac variety of a total anomalous pulmonary venous drainage. I hope you enjoyed this video, and yes, please do subscribe so that whenever I put a next video, you would be notified immediately. Bye till then, and keep learning.